Hello and welcome to all panelists and participants of today's conversation titled One Year Later, Now What? Haiti Earthquake Update. My name is Ariel Dominique. I am one of the co founders of the Haitian Ladies Network. We are a powerful, professional, and social global network connecting more than 80,000 Haitian women from across the US, Haiti, and throughout the world. Our mission is to create the largest global platform connecting all women and girls of Haitian descent to build community, share inspiration, and celebrate cultural heritage. Our story began more than 16 years ago with a small annual networking brunch in Washington, D.C. for 5 professional women that evolved into a 3-day annual sold out gathering that seated the Haitian Ladies Network. We are an active year-round network engaging members daily through our private Facebook group and other digital channels with trusted content uniquely designed to respond to their interests, needs, and long-term aspirations. We are honored today to welcome once again the Zanmi Lasante PIH team, who 1 year after our first conversation will give us a briefing on their work since the 2021 earthquake. Following this earthquake that struck Haiti's southern peninsula the morning of August 14, 2021, Zanmi Lasante mobilized an immediate response to address the most urgent needs of those affected by the earthquake. To share details of its emergency response in the days following the earthquake, Zanmi Lasante participated in a panel discussion hosted by the Haitian Ladies Network on earthquake relief efforts. Today, this panel will explore progress made during the 3-month emergency response phase, lessons learned, and long-term efforts to strengthen emergency and trauma care in Haiti, whether responding to a global pandemic, natural disaster, or other crisis. To introduce the panel and lead the conversation, we have today with us Ms. Saskia Vitiello. She is the Partnership Relations Officer of Zanmi Lasante. In 2012, she received a Bachelor of Science in Biology from Florida International University, and in 2018, she acquired a nutrition certificate from Precision Nutrition. Prior to joining Zanmi Lasante, she worked as the floor manager at Caribbean Supermarket in Haiti. She also spent 3 years working at the Miami Center for Advanced Cardiology in Miami, Florida, in the Medical Records and Administrations Department. Saskia joined Zanmi Lasante team in 2018, supporting the development team. So without further ado, I welcome you once again to this interesting and important panel, and we welcome Saskia Vitiello to lead the conversation. Thank you.
Thank you, Ariel, and good afternoon, everyone. Thank you for joining us, and thank you to the Haitian Ladies Network for putting this virtual panel together to reflect on a year after the 2021 earthquake. Like Ariel said, my name is Saskia Vitiello. I am the Partnership Relations Officer at Zanmi Lasante, and I'll be your moderator today. Zanmi Lasante was established in Haiti over 30 years ago, focused on offering a preferential option for the poor. Zanmi Lasante, as a partner to the Haitian Ministry of Health, supports 17 health sites in the Central Plateau and Lower Artibonite regions of Haiti. We have always taken a whatever it takes approach to provide patients the best care possible. This includes ensuring care is always available and free of cost. Following our panel discussion, a short question and answer session will be held at the end of the discussions. If you have any questions for our panelists, please type them into the chat. Before we get started, we will present a short video of ZL's immediate response following the earthquake. This video provides an overview of our intervention during the past year. Please play the video, Ashley.
One year ago, On August 14, 2021, a 7.2 magnitude earthquake struck southwestern Haiti, leaving more than 2,200 people dead, more than 1,800 injured, and countless displaced. Additionally, 97 health centers and 1,250 schools were damaged or destroyed, further weakening an already fractured healthcare system. The epicenter was located approximately 78 miles west of Port-au-Prince, hitting the cities of Les Cayes and Jérémie the hardest. Although Zanmi Lasante, the sister organization of Partners in Health, doesn't have any operations in the South, our team could not remain idle. We quickly dispatched an estimated 400,000 medical items and consumables, including portable ultrasound machines, hospital beds, canes, and oxygen tanks, to support departmental hospitals in the South. Our team of physicians, nurses, residents, and psychologists supported a total of 36,825 patients through multiple mobile clinics. More than 3,113 survivors benefited from psychosocial assistance, which included food and hygiene products and school materials. Our team provided direct medical assistance to patients at Saint Boniface Hospital. The hospital's medical staff were trained in orthopedic care to respond to the most urgent needs, including management of bone fractures, abdominal trauma, and crush syndrome. Louis was home in Les Cayes, brushing his teeth and going out to fetch water when the earthquake hit. The 4-year-old boy's head and arm were injured after he was struck by stones. He was brought in for immediate treatment. Healthcare professionals wrapped his arm, and our partners at Haiti Ambulance took him and his parents to Hôpital Universitaire de Mirebalais, HUM, where he received life-saving treatment. As of today, Zanmi Lasante has received and treated 67,658 patients from the earthquake zone with severe conditions, including those requiring orthopedic surgery at its tertiary referral hospital, Hôpital Universitaire de Mirebalais, HUM. We've provided physical rehabilitation and mental health trainings in Les Cayes, Jérémie, and Miradouane. We also wanted to establish plans for medium and long-term support with regional partners. With this objective in mind, agreements to provide concrete support in the earthquake-affected areas were signed with the health departments as well as local organizations. We are continuing to provide needed medical supplies and equipment across the earthquake-impacted regions, as well as support the construction of 3 permanent health centers in Gauthier-Civil, Plaisance-du-Sud-Nip, Baie-du-Mel, Saint-Louis-du-Sud-South, and Basse-Rivière-des-Ormeaux, Bourbon-Grandens. 1 year later, we are still committed to providing care and assistance to the South in partnership with the Haitian Ministry of Health, MSPP. We see the importance of growing the number of trained healthcare professionals that are especially needed in crisis situations such as this one. This is why we are currently finalizing curricula for orthopedics and emergency residency programs for clinical nurses at our secondary and tertiary health facilities in Saint-Marc and Mirebalais. These residency programs will dramatically increase the number of highly trained specialty clinicians in Haiti and strengthen access to this advanced care throughout the country. We are grateful to all who donated and supported the work that Zanmi Lasante does in Haiti, and specifically in response to the August 14th earthquake. We are more than ever committed to providing quality healthcare to the most vulnerable here in Haiti.
Thank you. Now let me present you to our panelists. First, we have Marc Julmis, who is the Interim Executive Director of Zanmi Lasante. Prior to this role, Marc was Chief Nursing Officer and the Deputy Chief of Operations at the University Hospital in Mirebalais, HUM, where she oversaw nursing care and education also focusing on operational leadership, strategic planning, and capacity building. Working in the nursing profession for over 20 years, Mark received her bachelor's degree in nursing from Atlantic Union College and her graduate degree and certificate in humanitarian assistant from Loma Linda University School of Public Health. Next, we have Dr. Wesley Lambeau, who is the Deputy Executive Director at ZEAL. Dr. Lambeau brings 25 years of management and leadership experiences. He earned a master's degree in healthcare management from Boston University and received several executive trainings in research, program, training, and finance management. He has more than 20 years of experience in global health program implementation and management and evaluation in Haiti and Rwanda. Dr. Lambeau joined the Zanmi Lasante team in 1997, where he served successively as a primary care physician, director of Las Caobas Health Center in 2002 to scale the HIV program, and served as interim director of Belader Hospital. Lastly, we have Dr. Michelson Padovani, who has spent his career working toward health equity and access to care in Haiti. He graduated medical school and completed his residency at the State University Hospital in Port-au-Prince, Haiti. From 2013 to 2016, he had the opportunity to work at the newly constructed hospital in Miobale, where he was a pivotal member of starting their programs. He then received a Master of Science in Global Health Delivery from Harvard. Afterward, he returned to Haiti as the Chief of Surgery at Saint Boniface Hospital in Fond-des-Blancs, and is now currently working at ZEAL as the Surgical Coordinator. Now, without further ado, we'll jump into the questions with our panelists. Our first question. Let's go back to the urgent response. In the hours and days immediately following the disaster, walk us through ZEAL's approach. What were some key steps taken to assemble an emergency response team and prepare supplies and equipment?
Well, on August 14, right after the earthquake hit the Southern Peninsula, I received a call from the director of programs, and he told me to gather a team in response to the earthquake that hit the Southern Peninsula. And at the same time, many meetings were held between Zanmi Lasante, partners in health, Ministry of Health representatives, and sister organizations in the Southern Peninsula, specifically Saint Boniface Hospital. And in less than 24 hours, we had a list of other 30 people volunteered to go to the South to help. There were mostly physicians and nurses and other personnel from Zanmi Lasante and Ministry of Health. And in that first 24 hours also, we were able to mobilize 2 trucks of materials and supplies for the South. And the goal was to we had 3 priority goals, and these goals were to provide emergency support and medical care, direct emergency support and medical care to the people affected, and to procure and distribute urgently needed equipment and supplies, and third, to directly support Ministry of Health and partners based in the affected areas. And in fact, we took care of over 40 people. We provided direct care to over 40 people at Saint Boniface Hospital. And we have collaborated with the team there, we have trained them in orthopedic care. And as a result, as an impact, they have now an orthopedic program that is providing care for the patient in the Southern Peninsula. And also we accompanied the Ministry of Health representatives in the Southern Peninsula for the post-earthquake response.
Thank you, Dr. Padovani. Does Mark or Dr. Lambeau want to add anything before moving to the next question?
Sure. I could say immediately following the earthquake, one of the things that we took stock of was the staff that we had available. Also, how many of our reaching out to partners that were in that area to see what was the extent of the damage at that point. Also identifying what staff did we have, because we had staff members that had family members down there or staff that were there during their time off. In that, it was a real big, I could say really, it revolved quite a bit of communication with some of the partners, because we've worked with people in the South before. So it wasn't really, we've worked with our team, although we are primarily based in the Central Plateau and the Artibonite. We have had exchanges with those in the South, and we use those. We reached out to our partners, to our collaborators down there and saying, what are the things that you need? And we were in the middle of some trainings at that time, specifically with the Grandas area. And basically, as Dr. Padovani shared, was looking at the staff stuff, space and systems. What do we need to mobilize? At the same time that we're mobilizing our staff to go down there, what are the safe areas that we have? Because initially we could mobilize to the St. Boniface area and work with our team over there. But it was also at the same time reaching out to some of the other areas and seeing what's the level of danger that are existing there, because if we're going to send staff out there, the complications that also, and I don't know if you guys remember during that period of time, as we were mobilizing staff and materials to go down there, we also had a hurricane heading our way, or a temps that was heading our way at that time. That gave us a short window of opportunity to get people out there. So at the same time you're mobilizing, we're also looking at the weather patterns, working with some of our partners that some of from the US that were the UNOP that were flying to helicopters, reaching out to other partners, what flights were available. Those were the difficult parts of mobilizing, and also trying to get equipment across, because there was also a gang issue that you're dealing with within that you had to traverse. So dealing together with that gang issues and making sure that staff is safely going through there. And then the other option of flying through, you're thinking about how quickly can we get materials and staff mobilized to get through to that short window of opportunity that we had to get people out there. So there's quite a bit of things happening at the same time where we are working to get staff and support and materials as quickly as possible to the southern area. And also, I don't know if you guys recalled, there was also because of the earthquake, there was a landslide that prohibited most people going down towards the Jérémie area. So there was there was a lot of communication that was happening with the team. We had formed prior to this a community of practice. And so that helped us reach out to some people very quickly to see what the situation, and giving us the stats of what was going on, so that we could also better mobilize some of the equipment that needed to be done. So at the same time we were doing that, we were also dealing with the elements that were beyond our control. But one thing I do want to say is, while we were managing that, we also had our staff that did a drive and started raising up some of the other equipment, materials, toiletries and so forth that could be sent down to the South, as we were looking at medical equipment, to send down medical equipment and supplies.
Thank you, Mark. Let's move on to the next question. There were thousands of patients with critical injuries treated, and some even airlifted to the University Hospital Emile Bale. How did the team prepare for the arrival of those patients? And beyond the medical care they received, what type of support was providing during their stay, and then once they returned to their homes?
And I can say that, okay, Mill Valley Hospital is a really busy hospital. Was already busy before the earthquake. So we received over 30 patients in our facility in Mill Valley. So what we did, we kind of increased our capacity, and we moved personnel around, and we even hired new personnel to be able to take care of these patients. And we know at this time that they were not only people with fracture or with a wound, but there were also people who lost their home, and maybe who lost family members, who lost relatives. So what we did, we took care of them clinically, but we were also able to provide some social support to them. Unfortunately, we lost 3 patients, but we took care of funerals. And when patients were able to get discharged, we even provided a transportation fee to go back to the South.
Thank you, Dr. Padovani. Dr. Lambeau, anything to add? We can move on to the next question. What are some of the challenges that the team faced when responding to the urgent needs of those affected by the earthquake? How were they overcome?
I think if I could jump in there, I think some of the things that, and I mentioned them a little bit, was the weather was a major part of it. Identifying also one of the major issues that we have was getting through to the Michelson area, which caused quite a, although later on there was a ceasefire that did permit us to go through, but there was still a level of danger there. But also the amount of flights available. We did have some really great people that we collaborated with that offered spaces on the airplane that we were able to move personnel as well as move materials down. So it was really on the positive side, it was a really great collaboration. As we hit roadblocks, we were able to reach out. We had, I don't know if I'm not sure if I'm allowed to say this, but we also had one major NFL organization that did provide their jet to be able to move some equipment and materials down through, so we could get it into the country and down to the South as soon as possible. A lot of collaboration with the Ministry of Health, also for the equipment, food supplies. It was, I'm not going to say that there was not obstacles. There were great obstacles in trying to move things around, but at the same time, there was a lot of communication to get around those obstacles. I think one of the other parts was in the early days where patients, they had a staging area at the airport where patients were being moved to, making sure that by the time they came to us in Mirebalais, that those patients have been identified with family members identified. We did pull our social work team, because one of the things is the risk is in that type of emergencies, as you're trying to get that patient to care, is losing track of that family member, and especially if they're children, to not be able to link them together. So it's also bringing together our social work team, our psychologists, so that they were on hand to provide those support. I think some of the other issues that you had is, I think it's really the major part, I could say, the challenges that we have was the weather. And we also had staff that were down in the South that were that were victims of the earthquake, and staff that continued to work, even though they did not have knowledge of their family members. Unfortunately, some of them did find out that they had some family members that perished during that earthquake or were injured significantly during that earthquake. So at the same time, we knew that we were taking, and this is going back to our S's, right? The 5 S's that we do. At the same time, we know that as we're taking care of our patient, providing that support, we had to provide that social support for both that patient and the staff. I could tell you one story where, and when we went down a little after the earthquake with Paul Farmer, he's somebody that connects quickly with patients, right? And as we transferred some patients back, you know, something as simple to some people as a patient that lost their phone, but that's something big because that means there's no way for them to communicate with that family member, for them to know where they are, because they were hella airlifted to get to Mirbalay for care. At the same time, it was our team that really looked at the social support as saying, like, what do they need? Not just for the patient, but for that family member that accompanied them. How do we provide that accompaniment to them and not just let them be in that area? So I think the challenges was trying to make sure that we were keeping in contact and we were linking to the family members. And as it was evolving, because we were also looking at, you know, those aftershocks and each aftershock and what was happening during that time and trying to make sure that we were maintaining communications. But overall, I could say the top three was weather, communications, and social support. And transport, I'll add that fourth one.
Thank you, Mark. Next question. Tell us more about the important role partnerships with MSPP, the Ministry of Health, and other organizations played in the coordination of the response and recovery effort. How do you think those partnerships affected the response?
I'll let Dr. Lambeau answer that. I could just start off really quick. It's essential, and it's tied to our name, Zanmi Lasante, you know, friends of health, partners in health. I think Dr. Lambeau can elaborate a little bit more, but in everything that we did, it was crucial to reach out to those friends, to reach out to those collaborators and make those partnerships, because when we talked about those obstacles, it was those partners that helped you open the doors to those obstacles. St. Boniface, for instance, which were doing work already in the South, we went to provide additional assistance to them. Even while we were there, before we could get some of our cars and equipment down there, St. Boniface also provided support for housing and transport, and furthermore, and I think, Dr. Lambeau, do you want to elaborate more about some of our partnerships?
I can hear you.
Dr. Lambeau, we can't hear you.
While we're trying to get him back, one thing I could say about those partnerships is the MSPP was crucial, because one of the things that we need, you know, when they had the cluster groups, we wanted to make sure that we were part of those cluster groups. So we had different members, and Dr. Jasmine, who was unable to join today, we made sure that we linked to the ministries or the departmental directors in each of those areas to ask them, what do you need? What do you need for us in the short term? What do you need from us in the medium term? And what do you need for us in the long term? Because we know that earthquake is not a short-term issue, right? It's an emergency, it's a disaster that happens, but how do we provide that support so that we're going to mitigate the loss of lives going forward? Or minimize the loss of lives going forward, sorry. In that, with that, cluster groups, there are several cluster groups going out and having communication and updates of what's happening and who's doing what, because it also is important to not overlap, right? And waste resources. So if we knew, it sounds like he's back on. If we knew, as we collaborated or we communicated, we knew one was in this area, we did not have to go to that area. I would also add that we had one of our partners that was down there and with several medical residents, but did not have supplies. So he's there, he's ready to do work and had several people. But then what we were saying is like, let's provide you with that supply that you need to get the work done, where we're looking at another area. So we're not overlapping and duplicating efforts in one area, but we're expanding and we're trying to provide as much support as possible. At the same time, you also had to realize that COVID was going on. And so that was high in the mind and saying, as we're providing emergency support, how are we also addressing the risk for COVID? Because now you're having a population that's also that now don't really have health centers, but that's the high risk of exposure. So in communication with the departmental directors, in communication with other partners to see what are the needs that are done. I'm not sure if Dr. Lambeau can come back on. But that actually helped quite a bit. And I think the key part was us asking them, what do you need? Because we can come in and do all this, but what do you need to help continue? Because they had employees ready to continue work. They just needed some extra supplies. Go ahead, Dr. Lambeau. I'll go on mute.
Can you hear me now?
Yes.
I don't know. I have to connect my phone and my laptop. Yeah, Mark, I think you said a lot, and I would say this is one of the most successful partnership. I will also say that we learn from our
You're on mute, Dr. Lambeau.
Can you still hear me?
Yes, now it's good.
Okay. Yeah. And at the very beginning, what we did, we went down to the south and sit down with the what we call like the health district directors to follow their guidance. They were the one to tell us what to do. And this was very important. And I can tell you, doing one of the meeting with the Ministry of Health and the partners, they acknowledge and underline that point. So we also learn from that experience that having that coordination under the leadership of the health district directors prevent the waste of time, equipments, and anything. But we also learned from that coordination when partner was going to leave and what to expect in terms of filling the gaps. And this is what we have been doing over the last 7-8 months, because all partners left 3 months after. Over.
Thank you, Dr. Lambeau. Next question. What were some of the key differences and some lessons learned between the August 2021 earthquake response and the 2010 earthquake response?
I was still in residency, and in 2010, maybe Dr. Lambert has more to say about that. But I can say he will add to what I'm saying right now. But I can say that one interesting thing is the first response were from Haitians, from physicians, with physicians from UE, from the State University, who went there the same day, not knowing we're gonna sleep, we're gonna stay, what they're gonna eat, but they jump in the bus and they went to the south to help the fellow citizens. But as I said, I was a little baby in 2010. So Dr. Lambert.
Yeah, Padovani, I think you point out a very important aspect of the difference between the two disasters. Yeah, the point about Haitian being in the first responders, it's a good one. The other point also is the better coordination. Even we had that central level of the Ministry of Health. In that situation, it was the health district directors to coordinate and lead that effort. Padovani made a good point. Actually, this is one of the reasons we have the mobile hospitals built, is to help the country respond quicker and better to disaster management. And this is why with all the surgeons and that we have trained were able to go to the south and help those in need. And I would also say there was a better, there's a better coordination where the health district director were able to assign partners to different areas, rather than having partners working on each other's foot. The other difference also is unfortunately, it's a lack of resources. I would say in 2010, there was really a lot of resources, because I was the one to lead PIH and ZL effort in Port-au-Prince. And I could tell you, there was a lot of waste, duplications, and partners trying to be, to be seen. And in the South, we saw a bit of, more humility from the partners. But at the same time, a lack of long-term commitment. We didn't have, many partners committed to long-term, but by long-term, I mean, even like most of the partners, we really commit to the very, very short-term, 1 to 3 months. And PIDL and 2-3 other partners like UNICEF, Médecins du Monde were the one who stayed until now to provide some long-term response, as I think Saskia underlined about like the building of health centers. And we're still there. We are there for another year at least. Over.
Thank you, Dr. Lambeau. Next question. So the video did mention that ZL is supporting the construction of 3 permanent health centers in the South. So what is the status of that project?
It's ongoing. It's ongoing. We haven't started yet with the building, but there's different steps. There's in the process. The first one, was the identification of the places where those health centers will be built. I'm taking you back to these steps because it's important, because sometimes partners, and thanks, we're grateful to our partners. But in terms of construction, you have, there was like requests from several sites to have health centers built. And as you know, we have limited resources to provide that support to the health districts. Second was to have the approval of the DOS. The DOS is the Direction of Organization of Health Services, which grant approval for construction, and it takes months. It took months. We just got the approval of the overall project, the construction project. We just also received. We have the Mark. We have the drawing, and I just went from the south to meet some officials to reassure them, because they have experiences of partners promising and then they don't come back. So I was there on behalf of the leadership to reassure them. And we have words from BHI that the will, what we call, like, we are not technicians, so the will, the work of starting the building is going to happen like in November. But remember, Mark mentioned several challenges, very serious challenges. Getting the equipment, the materials down there is gonna be very difficult. Also, BHI mentioned the quality of the, I think the materials, like the sands and stuff like that, they have to take them outside of the region down there. But in summary, it's ongoing. We are committed to complete it by the end of 2023.
And if I could add just a little bit, this is also part of us really quickly listening to the partners, because initially the plan was to build these temporary structures so that we could immediately give them several of them. We said we wanted to build 3 in each area so we could give them a health center that they could go. And they said, you know what? They came back. We said, more than building a temporary, give us a permanent one, because temporary, the time for us to get a permanent place. And so that had to in there, you have to reprioritize or rechange your plans and listen to what the needs were. And in that, then it started going into really selling the idea to other partners to go on and say, instead of a temporary, what is being requested is a permanent structure. And also making sure that, as Dr. Lambeau stated, that zone was so important because you had to do soil studies. You had to make sure that that zone was appropriate. That is it going to be in, because we also have to deal with weather down in the south. So they do get quite a bit of activity due to hurricanes and winds and so forth. So there was a lot more going on to decide on what those sites were. So the timing, so it does take a little bit, because we wanted to be intentional and we wanted to know that if we're going to provide support, that this is something that's going to last us a little bit more than something that's temporary.
Just a few seconds, Mark, to emphasize that the sites were chosen by the health district. Everything was decided by the health authorities. We are just there to accompany.
Thank you. The next question, what are some of the initiatives in place to strengthen trauma care and emergency medicine in Haiti for the long term, and specifically through ZL's network? Dr. Padovani did mention a little bit about the orthopedic residency program. We can elaborate more on that.
Yes. What we did, we are taking steps to kind of strengthen trauma and emergency care in Haiti. And what we started doing was, one, to put in place in a system called like an incident comment system. We were still building it. It's not yet done, but we are still working on it. But we also are trying to strengthen the system by doing education. We are opening a residency program in auto trauma, and also some kind of training program for clinical nurses. Also, we have at HUM core residencies program, but also multiple fellowships in plastic surgery, fellowships in point of care ultrasound, fellowships in neurology, fellowships in gynecologic cancer. And one thing that I think I should mention is our oncology program, because it is unique in a sense that it is the only program with a surgical program integrated, with a surgical component integrated in it, and that is free of charge. So this is the only program in the whole country with a surgeon attached to it, and that is free of charge for the patients. The ER fellowship, the ER residency program that we have also, it's unique because it is the only fellowship we have in the country. So I think we are taking a lot of steps to strengthen surgical care, care in general, and emergency care in Haiti. Maybe, I don't know if Mark or Lambeau would want to add.
Yeah, absolutely. Thank you, Dr. Padovani. And I'm so happy you mentioned like Dr. Padovani mentioned, we are establishing a disaster management team. We are not a disaster management organization. However, we do respond because we are in the country. It's part of our duty to respond. And so we are formally establishing a disaster management incident response team. We have one in place for pandemics, or really we dealt with the pandemic for epidemics that are developing, but now we're looking at more physical or other disasters, expanding on that one. The other thing Dr. Padovani did mention, yes, we are putting together and starting the ortho trauma fellowship. We are starting a nurse practitioner, emergency nurse practitioner, acute care nurse practitioner fellowship program that will be able to be in some of these areas. Because just to explain a little bit, one of the reasons we're focusing on that, and it's so funny, and Dr. Lambeau mentioned it, this is why we have HUM Hospital that came out of the 2010 earthquake. We know it's the long game. It's the planning for what is to come that you're preparing. It's not just responding to the immediate disaster. So what we're doing is we're developing a cadre, these professionals that can be available for the country so Haitians can respond to Haitian needs. We have about 98% of our graduates right now from our resident programs currently working in Haiti. 88% of those are in PIH supported facilities or in other rural settings, health facilities. We were able to get one of the needs, and also we have a nurse CRNA, a nurse anesthesia program. And one of the critical needs and Dr. Padovani, you could share with that, when we had our surgeons go down, we also had to send our nurse anesthetists down to go ahead and provide support. And that just showed even more that we need to have more nurse anesthetists out in the country, because to be able to provide the support. One of the things I remember in JME, when they were asking for support, they were like, I need anesthesia care. We need anesthesia care. We have people here, but I don't have anesthesia care. So it's saying, like, how are you going to respond and provide and invest today for what might come tomorrow? So we're not necessarily, and this is what I call sort of waiting for help, but we're able to go out and provide that assistance. At St. Mark, we're looking at reinforcing and developing a true ED. I'm not talking about a space that we're calling an ED, but I'm talking about a true emergency department that can respond to the needs over there. It's reinforcing the emergency services at some of the different facilities so that Mirbalais can really be seen as a tertiary care facility, and we could take care of some of that. But we also have other facilities that are able to provide a level of care. And so it becomes a health network with the Ministry of Health facilities, rather than just focusing on one facility. But it's really, how do we reinforce, which is what we're here, the health system, both at the Central Plateau and in the Artibonite, but with the 3 health facilities, it's not us just building those health facilities, it's also looking at how we partner with the ministry to outfit them. What materials do they need to be there? And also what we did is a component of training in there, is how do we provide some accompaniment and training in that, so that it goes it goes beyond the short-term assistance that we're providing. There's so much more, and we could probably share out if people want to know, and we could share it. We have some information posted on our website, but just because of the sake of time, there's so much more that we're doing, because we are looking at how do we strengthen the health system of Haiti so that Haitians can respond to Haitians' needs.
Thank you. Let's move on before the time is up. Mental health is a priority for ZEO. What support was provided to people to help cope with the disaster on top of everything happening in the country?
We had a mental health team. We went down there to support patients, and even personal, because we had that team right before going down, before they went down to the south. There was a team, they were there to kind of, support personnel and people like employees who have lost relatives and in the south during the earthquake. And then the work was still here at Mirbalais, but also we had a team down there to support people there, the victims.
I will add that remember, both Mark and Padovani mentioned that we had dozens of our staff that are from the southern region whose family were victims of the earthquake. Our mental health team was there for them in our network for support, as well as traveling to the southern regions to see people. We also conduct 2 trainings for the health center staff. It's a bit of kind of mid-term, long-term investment in the staff so they can take care of the staff. I would also, the same mental health team is also committed to return next year for refreshment. So our mental health team is stronger than ever, and they will be there for any natural disaster, as they will happen anyway. Over.
Thank you. As we reflect back on 1 year later after the earthquake, would you say that ZL and Haiti more broadly is prepared for the next disaster?
I laugh. I think we could also say, I don't want to say we're prepared, but we're getting to where we can respond. Because we don't know what the next disaster might be, but so preparedness, it's almost a construct that's saying, but I think we're setting ourselves saying like, we're there to respond. We have the team, we have the staff, we'll get the stuff. We're putting systems in place, and we want to make sure that social support is part of it. And so we have our 5 S's, and we're there depending on what the disaster is. Of course, you have to modify what the needs are, because we did not foresee in this earthquake, after this, the issue with the gang or the flight or so forth. So I think we are here to respond and support the government of Haiti the best we can.
Thank you.
Yeah.
You want to add something, Dr. Lambeau?
No. I was just going to say that we, as Matt mentioned, this is from our side, from the other country institutions, not really. But I would say they learn from previous disasters. They are not ready, they're not prepared, but their response has improved. I would put it that way.
Yeah.
Great. Well, this concludes the question part of the discussion. Thank you so much to Mark, Dr. Lambeau, and Dr. Padovani. Now we can leave some time for some question and answers. Let me check the chat to see. Before the first question, we do have a comment for Dr. Lambeau that somebody said they interned with Dr. Lambeau at ZL for over 10 years ago, and they were the best introductory into my public health career. That's from Teresa Alphonse, Dr. Lambeau. Okay, the question.
I would just thank you so much, Teresa. It was an honor for me to coach you.
The first question in the chat was, out of all the challenges, what would you say is the biggest challenges in providing care?
I would say today, the biggest, as of now, is security. That's all around. The security is our biggest challenge. We can talk about fuel, because those are 2 things that are making it very difficult to move forward. But fuel is also tied to our security. And so those are things that you have to think about, not just for patients coming up, and because tied to security is now you're having a overflow of patients going to one facility because they're unable to go to others. We're having an increase in maternal patients come in to some of our facilities because they want to be closer. You don't know what's going to happen. They want to receive care and not be stuck on the road. We have our staff that are taking every day when they're coming to work is at risk for kidnapping and at risk, they're also dealing with family pressures and saying not going to work. It's better for you to be safe, but And I can share, and not to go into it, we have staff members that have been kidnapped. So it's really continuing providing service, but the security risk to our staff and our patients is one of the major challenges that we have, but we continue to do it. Our staff continues to take that risk anyway, that we have now. But I would say it's also the health infrastructure that exists in some of the areas that we need to reinforce so that it's not so concentrated in one area. And that's why we're focusing on how we're reinforcing specifically emergency care services, maternal care services at some of our other sites so that those become a secondary facility, depending on what, or and then we are able to look at the health as a network rather than an individual facility.
Mark, since you mentioned the security situation being our biggest challenge, how does the team stay motivated and encouraged?
I think that's a very good question. And I don't think that's something that I could answer for everyone on the team because it is, you're looking at mental health right now and you're looking at trauma, ongoing trauma. There's actually something that we talk about where, and I've delved into it a little bit more in other conversations where we're talking about pathological resiliency, because we talk about Haitians being resilient, but we also have this pathological resilience.
I think Mark lost the
Everybody,
connection.
what we're attempting to do.
Oh, there she is.
Oh, sorry. Oh, my internet dropped. I'm
No,
sorry.
now it's fine.
Okay, I think one thing that I would say that we're attempting to do is we've developed and created a mental health department, not for patients. We have that already for patients, but what we are developing is one for staff. We're in the process of hiring one, but slowly hiring a second one so that we have a employee health and wellness, but really focusing on physical health as well as mental health in there. These are attempts that we have. We're reinforcing, we can't discuss those security plans that we have with you guys, but it is reinforcing security at multiple ends to try to say it's not a guarantee, but we're reinforcing the best way we can, increasing communication among the staff to let them know when there's security risk. And also there's some other measures we're taking, but we're not at liberty to share only because of the ongoing security risk that we have.
Mark, I will add one more thing that is linked to security. It's a brain drain that have never been that worst. And it's because of security, we've been losing our best, clinicians. Padovani, we still have many very good clinicians staying in country. But I will add one more thing. If we don't do it, who's gonna do it?
Yeah.
So I will leave you with that reflections. I think this is one of the reasons that we are still motivated to help our brothers and sisters.
Thank you. We have another question. How can the diaspora community help? And any plans of having a health center in the capital? You are all on mute.
So to the last, I'll go backwards. No, there's no plans right now having a health center. There's an overabundance of health support within the capital. And I think one of our major things is how can we decrease or decentralize and really expand and make sure that health is available to people in different sectors. That's one of the reasons that we focus on the Plateau Central. That's the reason we're focusing on the Artabini area. We have some in even further closer to the border towns where we're providing support on there. But, and we are a small organization, relatively small compared to some others. And so we want to make sure that we're able to do the most that we can do, but also realizing that we don't want to overlap in areas of services where service is available. I don't know, Dr. Lambeau, Dr. Padovani, if you guys have anything to share with that one.
Yeah, I think, Mark, you already addressed the key point. But what's happening now in our network, in the Central Plateau and Artibonite, that was not the case 20 years ago. The Central Plateau was the region with less resources for health. Just for you to understand, when I got to the Central Plateau in 1997, there were 3 doctors for almost 500,000 of people. So there is no plan to build health centers. We want to decentralize. If we have the resources to build another health center, that's gonna be in the regions.
Thank you both.
And can I answer, how can the diaspora help?
Yes, go ahead, Mark.
Yeah, I think that's a really big part of it is actually our team started, and I think engaging the diaspora more, and I think on our end, I'll start for how we can inform, is I think the diaspora can help as we inform you guys, right? As we make sure that you're understanding some of the areas that we're moving in. I think there's areas of continued training, but really investing, not one-stop training, but investment in some of those areas of training, partnership, communication. We are developing, we continue to develop curricula. As I said, we are reinforcing St. Mark, the emergency systems at St. Mark, the maternal system, the neonatal and pediatric, which is actually was overlooked quite a bit in the earthquake, and we advocated for those other communities that were affected as much as those that were affected by crush injuries. I think these are things where we're looking at Bukankare, where we built a maternal center out there. And I think it's really, when we're looking at that, is saying, how do you, or what can you bring forth? But let's talk about collaborations. Let's talk about long-term partnerships. Let's talk about building a system, helping us build a system. When we're talking about this brain drain, Dr. Lambeau just shared, is those that have, as we're putting forth, as we're building these fellowships together, there's no nurse, for those that might be, there's no nurse practitioners. We're just getting our first nurse practitioner here. There's no ENP. That doesn't exist. We're creating that right now. We're developing that curricula. We're developing that fellowship. Like, we just finally got our first nurse practitioner from one university that's doing out there, but now creating those fellowships that they're ready for. We have the trauma, we have the plastics, we have these that we're putting in place. And I think it's really we're also looking at healthcare financing. How do we get a better healthcare financing plan out in place? So it's really saying is, and we have such a great team, is what are the information that would be helpful to the diaspora to know that what we are doing, and how do you see yourself engaging with us? And let's start that discussion.
Thank you, Mark. It looks like we have covered all the questions that were asked. Do you guys have anything to say to wrap up?
Well, I guess I could say is, it's a pleasure. A lot of times, and I share with people, for the most part, I'm not one that likes being on camera, but it's, when the country is a little bit better, when we had visitors come through, it was such a pleasure to have visitors come through, because it gets you out of the daily and it gets you to see, wow, because on a day part, you're just doing, you're going, but then it gets you to step back. And I want to thank you guys for that, to see, okay, we are moving that needle forward. It's taken a long time to move it forward, but we are moving that forward. And it's always a pleasure to share some of the things that we're doing, and share the amazing work that our staff is doing, our team, and how they do it every day, and how they show up every day for our patients. And I know our time is short, but I want to commend our team because this is a time like no other. This is a time that we're going in Haiti like no other. And people are making the decision to stay while they're sending their families away. So because they feel like they have a commitment to Haiti to move things forward, and with the hope that things will change. And a lot of people have asked, there's 2 questions I want to pose. A lot of people have asked, one, what happens now after Paul Farmer, his passing? And that was devastating, and still is to a lot of us. But people also have to understand, Paul worked in building a system. He was this great visionary, and it's come to fruition. He built this system of these facilities, these, Lambears that have been here for years, that's imparting their knowledge to others and that's sharing. That's that generational knowledge that's going ahead and sharing. And that system continues today. We are still advocating, but at the same time, our core mission is we are here to provide preferential option for the poor. We are here to provide health care. And it's not an organization. It's not just doing, it's about the mission of in the heart, which is the heart of the organization. So you have people that staying for years in the midst of the craziness that we're dealing with, because they're also tied into the mission. Mm-hmm. I think what I want to say is, when people wonder, like, why bother for Haiti? Because there's always that hope. We're continuing forward because it's not just today we're seeing what's going to come for tomorrow and how do we prepare for tomorrow. So our vision is not for the moment. Our vision is on a long game.
Thank you so much, Mark. Very well said. As we wrap up, again, I'd like to thank our panelists, Mark, who's our interim executive director, Dr. Lambeau, deputy executive director, and Dr. Padovani, CL surgical coordinator, for participating in this discussion, reflecting on ZL's earthquake response 1 year later. Also, we would like to thank Haitian Ladies Network for helping to organize this great virtual discussion. And thank you to everyone who attended today's panel. We hope you have learned and enjoyed this presentation, and the recording of this webinar will be available soon for those who wish to share it. Also, if you would like more information about Zanmi Lasante, please check out our website, zanmilasante.org, and our social media accounts, which are Facebook, Twitter, and Instagram, to learn about our work in Haiti and stay up to date about what's happening. Thank you again and have a great rest of the day.
Thank you very much, Saskia. Thanks, everybody.
Thank you. Thank you all.
Once again, we would like to say thank you to everyone for watching this most important webinar called 1 Year Later. My name is Nashley Harrigan. I am with the Haitian Ladies Network, and also have volunteered with Zanmi Lasante as an attending physician, an ER physician in urgence in the past. We'd like to thank Saskia for being such a wonderful moderator and our level of expert panelists here. We would like to thank Zanmi Lasante. We ask that you follow them on their social media. You sign up for their listserv so you can find out how to help support them and their efforts to provide free healthcare through Haiti. We are, once again, the Haitian Ladies Network. We have over 75,000 members of women in Haitian descent. We have our signature event that is about to happen this October 7th through the 9th in DC, Washington, DC, where we've had over 600 women attend per weekend. Follow us on our social media at Haitian Ladies Network. Sign up for our listserv. Visit our website, HaitianLadies.org. And you guys have a wonderful, wonderful, wonderful afternoon.